joins me now. Congressman Ruiz, a Democrat from California. Congressman, healthcare premiums, they're not affordable right now. That has been a massive complaint we've heard for months. Now, a previous assessment of the GOP healthcare plan said that premiums would originally go up 15 to 20%. Eventually, they'll become 10% lower. That sounds like a positive, assuming it's true. You might not like the Republican plan, but...
That's a great assumption. You know, Trump Care 1 was terrible. Trump Care 2.0 is even worse. Premiums, deductibles will all go up. The bottom line is that what we care about is the out-of-pocket costs for the American people, the patients. Premiums can go down, but deductibles will go up. So you get bamboozled by getting a lower premium, but a higher deductible when you need it. On top of that, Trump Care 2.0 is going to take away all those guaranteed benefits of being covered for emergency care, mental health, maternity care, and pharmaceutical drug prices. Therefore, that moment when you need your insurance, you're going to be left alone to pay for it. So that's absolutely false that premiums or out-of-pocket costs will come down, because out-of-pocket costs is going to go up.
Well, you yourself are an emergency room doctor, but last month you wrote an op-ed in the Holland Sentinel, and you wrote, quote, "The Republicans aren't interested in improving the AHCA. They'd rather attack it for political gain." You went on to say, "This is what disgusts voters about Washington." So that's a criticism of what Republicans are doing, but day in and day out we hear more complaints. Just yesterday, Aetna dropped out of the state of Virginia because they said they're losing so much money. What have Democrats done so far to help improve this bill and work with Republicans?
Well, the health insurance market has been destabilized because Republicans have avoided the risk-reducing programs that help health insurance to have a good combination of high-risk, low-risk people. The administration has decreased their outreach efforts, leaving only the really sick in the insurance market. Of course, the Republicans want to make it worse so that then they can use that to scare people and say, see, the Affordable Care is not working. What we need to do is come together to re-evaluate those risk mitigation pools, which will incentivize health insurance markets to come in. And we also have to have a public option with Medicare as the public option. These are simple solutions that we can get together and do right now.
Well, you're a member of Congress. Are you making efforts to come together?
Absolutely, I'm making efforts. I'll pick up the phone, I'll call anybody who wants to listen. The problem is that they're making these changes without calling or discussing with Democrats behind closed doors and without the information that we need to truly analyze whether this is good or bad. Listen, let's not kid ourselves. This bill is worse than a sham. This is worse than a sugar pill. This is downright ugly. This is poison. This is going to allow private health insurance companies to drop people with pre-existing illnesses, with diabetes, asthma, any other condition that they have, and say, now we can drop you because you can go to the high-risk pool. The high-risk pool is a high-cost pool, meaning that they're not going to get the coverage and the guarantees of coverage that they want. They're going to have to pay a hell of a lot more money, and they're not going to be able to afford it.
Then was it a mistake in retrospect for Democrats to rush the Affordable Care Act through Congress? It's such a massive undertaking, and clearly it needs improvements. Given where we are now, the fact that you're looking at this repeal and replace and saying it's a sham, it's worse than a sugar pill, should this have been handled differently by the last administration?
You know, first of all, I wasn't here during that time when the Affordable Care Act was done, but if you can review what happened, the debates on the Affordable Care Act lasted about a year with 80 meetings throughout multiple committees. This bill hasn't even been evaluated by the CBO. The stakeholders haven't been at the table. There's been no dialogue with Republicans and Democrats. What we need to do moving forward is let's stop the ideological hyper-partisanship and let's come into pragmatic solutions to figure out what we can do together. I'm willing to sit down. I'm willing to figure out how can we reduce costs out of pocket for patients, for care, and for medicines. And that's not what this bill does. This bill is going to increase costs for everybody. They're going to pay more with less coverage while giving $600 billion tax cuts to the wealthiest families.
All right, Congressman,
that's absolutely not fair.
I got to leave it there. Yes, no. Do Republicans get the votes today?
I say no.
All right, then. Thanks for joining me. When we come